Well, welcome everyone. It's great to see all of you here. My name is Teresa Slottick, and I am with Literacy Minnesota. And today we're going to talk a little bit about digital skills in healthcare, and specifically about one solution that we have that's both free and or low cost, but more broadly kind of what the need for digital equity and skills in healthcare, what we're seeing. So I'll give you a little bit of an overview as to who Literacy Minnesota is. Look at the reasons why we're hearing there is a need for digital equity and digital skills in healthcare. And then I'll tell you a little bit about our tool that may be useful for you. Again, there's much of it is free, and then just get you thinking about some things that maybe you haven't thought about before. So Literacy Minnesota, we are a nonprofit. We have been around for 50 years, and we work with adults who are, we work with them on literacy. So many of the people that we work with are English language learners or people who are trying to get a high school equivalency degree. And we also then work, of course, with these people on digital literacy. We are located in Minnesota, as you might expect, and we have 5 schools here in the Twin Cities of St. Paul and Minneapolis, again, working with a direct service with learners who are, focused mostly on literacy, various types. We also provide statewide training to volunteers and teachers who are working with adults around literacy. And then nationally, we have many resources that are free that people both nationally and internationally use us for. And we do advocacy around a mission of reducing poverty through literacy. And the belief of that group, it's a national group made up of volunteers from many different sectors. So healthcare is one, libraries, aging adults, adult education, because the belief is that we all work with similar populations and have similar missions. And so if we can band together, we can advocate for better funding for adult literacy, better funding, better legislation to support adult literacy, and more research around adult literacy. And then, of course, nationally, we do digital literacy, which we're going to talk about today. So why is digital equity important? Think about, I know there's a little bit of a lag, but think about what things could you not do if you did not know how to use a computer or use the internet? So imagine you're somebody who doesn't know how to use the computer or the internet. What are some things you couldn't do? And I don't know if you can chat these in, and or you can, I know there's a lot of people on the call, but just at least in your heads, think about some things that you can't do. And I know many times what people initially say is, I couldn't get a good job. And it is true that digital literacy, knowing how to use computers, is important for many jobs today, but it's important for so many other reasons. So if I don't know how to use a computer, I would have a very difficult time interacting with my child's school, for example, since most schools now have parent platforms and most teachers email parents. I also would have a difficult time filling in online government forms. So if I'm looking for some kind of assistance or signing up for a program, most of those are online now. You all know that in healthcare, it's difficult if I don't have the skills to participate in telehealth. I also can't access a patient portal if I don't have the skills or the equipment to do so. So when you think about digital equity and what you can't do if you don't have these skills, or if you don't have a device, or if you don't have broadband, it really affects all areas of our life. So just to remind you of the fact that those who aren't participating in the digital world are often left behind in many arenas. So yes, it's very hard to make appointments, to get business information, research health information, and providers. These are all great points that you make. Shop online, do banking online. So all of these things are really hard to do. Even, you know, order your prescriptions. You can't do that online if you don't have access. So you all had great ideas there. So when we think of digital equity, I like to present it as an image of a three-legged stool. And the stool has three components, and many times what's first thought of are that you need a device, right? So you can't really do much if you don't have a device to use. And then oftentimes, secondly, people will think about access. So if you don't have access to, you know, high-speed internet, it's again hard to do much. And a lot of money during COVID has been given to agencies, excuse me, to give out devices, to give Wi-Fi hotspots, to increase broadband. And this is all really great. And there are many people who that's what they need to be able to participate in the digital world. But what has often been kind of forgotten is that people also need the skills to use these devices and internet access. So you can give someone a device and let's say a Wi-Fi hotspot, but if they don't know how to use them, then they just kind of sit on the shelf and gather dust. So we also have to make sure that people are equipped with the digital skills they need to use the actual devices and the access that they have. Now we know that in healthcare, there is a high need for people who don't have digital skills, who could benefit from them. And as you all know, healthcare systems are more and more, especially with the pandemic, moving online. So I've been talking in the last year and a half, talking to many people in the healthcare system, providers, insurers, patient care advocates, nurses. And I consistently hear from people that, you know, telehealth isn't going away, healthcare portals aren't going away, more and more devices are being used, wireless medical devices are being used to monitor people's symptoms and specific diseases or vitals. And these are all really great things as long as everyone has access to them. And digital equity really is about racial equity. So many people who don't have digital equity, there's a higher proportion of people who are people of color, people who are from underrepresented populations, older people. And so as we think about digital equity in healthcare and just in general, we want to make sure that we are addressing providing digital equity to these populations specifically. Now, you may have heard that the Digital Equity Act was passed last November, and that means that states are going to be getting, you know, billions of dollars to develop digital equity in their states. And thankfully, as part of that, the writers of that were very thoughtful in including healthcare as a component there that should be thought of when we're thinking of digital equity. So I would highly encourage you to find out right now, this month, governors in every state are deciding what kind of government entity is going to be responsible for developing a digital equity plan in their state. They'll get $1 million to do that planning, which will take a year. And then once they have the plan, they can, you know, get some more of that $1.44 billion to their states. So I would encourage you all to find out who what agency in your state is going to be responsible for this, and have your voices heard in terms of what you are seeing for your patients or the people you work with. So as I was talking to all these people, it became clear that there was 5 areas at least where I kept hearing over and over again, there were skill gaps in digital healthcare literacy. And those, what kept coming up were in accessing telehealth, knowing how to do a telehealth appointment, using patient portals, using those wireless medical devices, how to upload the information, how to find credible medical information online, and looking at health insurance, comparing health insurance plans, especially online. So hearing that, North Star, which is the platform that we provide, decided that this was something that was an area that we felt we could add in to what we already have. And so I'll kind of tell you what we have. And like I said, we're a nonprofit. We do offer much of this for free, and I'll distinguish between what's free and what we offer for a low cost, just to keep the nonprofit going. So if you have questions at any time, you can put them in the chat, and I will kind of be, or you can ask them, and I'll be monitoring that. And then we'll have time for questions at the end as well. So North Star has been around for 10 years, and we're used by organizations like libraries, workforce centers, community colleges, four-year colleges, businesses, and adult education in all 50 states. So no individual ever has to pay for using North Star. Like oftentimes a library would get a subscription to it, or would use a free version. Because Literacy Minnesota is an organization that focuses on teaching adults English, North Star was initially created in English and used by many of those types of organizations who that was one of their primary goals. Since the pandemic especially, other types of organizations, as I mentioned, have started using North Star, and their main focus isn't teaching English necessarily. So there's been a big push from the organizations that use us to make North Star available in other languages. And of course, this is something we would love to do. For a nonprofit, the price tag to do the coding for this was fairly high, but we were fortunate enough to find funders and have started that coding, well, have finished actually the underlying coding process, and are now in the midst of doing the actual translation. And the first language will be Spanish. So we'll start rolling the Spanish version of North Star out this summer. And then after that, it'll be much cheaper and quicker for us to translate it into additional languages as we can. I see that someone asked about where to find more information about the Digital Equity Act. So the organization that's the government organization that's kind of heading this up is NTIA. I'll put that. And their website would have some more information on it. Right now, I will say that we are trying obviously very hard to keep track of what's going on. And we are hoping NTIA will create a website that will list every state's, what department in every state is working on this. They have not, that hasn't been decided yet, and they have not yet, but I just heard today that they will be doing that. So I would kind of keep track, put in NTIA Digital Equity Act, and you should hopefully find what they develop. Right now, I'm hearing it more from our contacts who are, working with legislators. So I haven't seen anything. I've seen much written, but I haven't seen any great website to direct you to. But if you follow that, and then North Star, actually our website, we're gonna put up as we find out, we will be providing that information on our website. So you can follow us at I'll put it in the chat. It's later in the presentation too, but sorry, I can't talk and write at the same time. You can follow, we're developing a landing page just to talk about that act. So that should be up there in the next couple of weeks, by the end of May for sure. Thank you, great question. All right, so so just so you know, right now, North Star is only in English. We do see the need to translate it to these other, to those of you who work in organizations where teaching English is not your primary focus. North Star is also fully compatible with desktops, laptops, and Chromebooks, but many, of course, of your patients use mobile, or the people you work with use mobile devices. And so we have now finished the coding to make it look good on mobile devices. So you can, that will also be being rolled out over the next 6 months. You can do the assessments that I'll talk about on mobile devices. It's just not optimized at the moment for the screen, but that will be coming soon. So let me kind of tell you more about what I'm talking about. So about 12 years ago, when the United States was in the Great Recession, our local libraries saw many displaced workers coming into the library wanting to, up their digital skills so they looked more attractive to potential employers. And the library was really excited by this. They had classes, they had room, but what they found was the range of digital skills was so great, they weren't really effectively teaching anyone. And so they came to us at Literacy Minnesota and said, you have experts on staff, you're connected nationally. Could you create some basic digital literacy assessments so that we know what skills people have, and then we can place them in the correct classes? And we thought this was a great idea. So we got those experts together and we created, we looked at what topics we felt fell under basic digital literacy, things like how to use email or how to do an internet search. And then for each of those topics, we developed standards. And the standards are really the skills you need to be competent in these areas. And those standards are all available to you for free. So as you're thinking about working with people around digital skills, or maybe what digital skills they might need to use to access your healthcare, those standards can help you just be a checklist to be like, yeah, these are the things that they would need in order to do X. Because we work with adults on literacy, we wanted to make North Star as accessible as we could, while still maintaining the digital literacy integrity of North Star. So everything is written at a grade 4 English reading level, which would be about if you're working with people for whom English is not their first language, about an intermediate level English language learner. And it's web-based. So anywhere in the world that someone has a device and an internet connection, they can access North Star. We initially thought it'd just be used in St. Paul. And we were, like I said, we had a free version, and that's all we had initially. And we were very surprised to see how quickly we got national attention and how much need there was out for digital skills. So when we saw this, we decided we wanted to maintain North Star. And as you all know, the digital landscape is always changing. So in order to maintain North Star and keep it up to date, we had to dedicate staff to it. Being a nonprofit, the way we decided to pay for that staff was to go to this subscription model too. So we still have a free version and a subscription version that was made to be low cost because we know we serve mostly nonprofits. So North Star started out with the assessments, and I'll show you a little bit what those look like. And then after several years of people using the assessments, organizations using the assessments, and just the feeling that they knew where the people they worked with, what they knew and what they needed to learn, many reached out to us and said, this is great, but I don't have time to develop curriculum or I don't have staff time or knowledge to develop a curriculum around digital literacy. can you, North Star, do this? And Literacy Minnesota has a long history of creating curriculum for adults. So this fell right into our wheelhouse. So we started creating instructor-led curricula. But then many organizations said, you know, we don't have staff time or room to actually have a class. Could you do something that's more self-directed? And again, we thought this was a great idea. So we developed some self-directed online practice lessons that people can use to learn these digital skills. And along with that came a learner management system and multiple reports you can see what's going on. I do see some questions in the chat. And so someone asked if it's free, what's the cost model? So we'll get into that whole bit. And I'll be sure as we go through this to tell you what parts are in the free version and what parts are in the subscription version. But in general, for an organization, let's say a single school or library, it would be a subscription is $500 for a year subscription, and that's unlimited learners. And then the question was, does the Digital Equity Act include libraries and community centers? Definitely libraries and nonprofits. I don't know that community centers are specifically called out, but I would think that they could be involved in that. And the Digital Equity Act also really strongly encourages partnerships. So if you provide one aspect of what they're looking for, and they're looking for organizations that serve specific communities. So English language learners are one, aging adults are another, people who live in public housing are another, the literacy groups, people who are, I think, 200% below poverty level. So there's a long list, and I'm not remembering all of them, but of specific targeted populations that this Digital Equity Act is intended to serve. So if you can find partner groups with yours, all the better. And the question is a great question too. Is a curriculum, can it be used for teens and kids? So this was created for adults, but we have found that many, especially in libraries, kids love using North Star. As you'll see, it's kind of gamified. And so they really like seeing how well they do and kind of proving to themselves their skills. We would say that it would be best used for people in middle school, kids in middle school and high school. However, there are some K-12 schools that use North Star, and they modify it through how the teacher talks about it. But there's nothing, so that's kind of what North Star says. So these are the assessments that we have, and all these assessments are free, and I'll show you how to access them. You can all take them yourselves if you want to. Each assessment for someone who is lower digital literacy might take 15 to 20 minutes to take. For someone who feels fairly competent, they might take 5 to 10 minutes. So you can see that there are 15 here. The ones in red I've highlighted, are often used in kind of more of a healthcare setting, but with North Star, you can use any of the assessments, and you don't have to use all of them. So no one person is required to take all of the assessments. There's no specific order that someone would have to take them in. But having said that, I would say the basic computer, the internet basics, and the using email are the most commonly given assessments, because without those skills, it's hard to do a lot in digital literacy. Most of these under essential computer skills, like I said, these are the basics. The essential software, a little bit Microsoft heavy, but we've added in Google Docs as that's become a major player in the market. And then using technology in daily life, these are a little more advanced, I guess. And most of them, social media, information literacy, career search skills, Your digital footprint is this idea that what you do online leaves a trace behind, and other people can see that. You want to be aware of that, and you want to be sure that what you're leaving online is what you want to be having, have people have access to. Supporting K-12 distance learning was created during the pandemic and meant to help parents with their kids who are doing remote learning. And then accessing telehealth appointments, it just came out a week ago, 2 weeks ago. And that's about what it sounds like, accessing telehealth appointments. So here's an example of those standards that I was telling you about. These are the standards for telehealth, for example. And you can see that they're very skill-based. So, some things you have to do is know how to create a secure password and know how to log in and sign out of your online health portal, using number 9, using virtual meeting features. So the standards were developed first in conjunction with people in the healthcare field. And then after that, the assessment was written. And the assessment itself, the assessments themselves are usually scenario-based. So here's an example of the telehealth, one of the questions in the telehealth assessment. So you can see that it's asking the person taking the assessment to actually perform the skill. So the assessments aren't true, false, or multiple choice. They're really scenario-based, and they ask you to perform the skill to show that you know how to do it. You can't hear this, but on the assessment, you see the words are written here at the top of the screen next to 16, but there's also audio. So there's a woman who is reading very slowly and clearly. You can replay audio as many times as you want. You can speed it up, you can slow it down. And so it is meant to, there's also closed captioning. So it's meant to address a variety of different learning styles. Here's another example of a question in the telehealth, in the accessing telehealth appointments assessment. And then a third. So this is a great question from the chat. How do people respond to the idea of an assessment to start? And then the question says, does this need some sort of specific engagement to ensure people don't feel tested? That is such a wonderful question. And I also do training on, implementing North Star. And that's one of the things that I really stress is that people often have had bad experiences with assessments. They feel that they're being judged. They feel that it's what they don't know is being pointed out, that this is, maybe they've had bad experiences in just in education in general. And so it is really important how you position it. And at North Star, when I'm working with learners, I always talk about how the assessment, the way North Star is very flexible, so you can use it in many ways. But oftentimes organizations will use it where they will give a pre-assessment to see what somebody knows, and then provide the instruction, and then the same assessment as a post-assessment to see what's been learned. So usually I recommend that you position it as, this is a way to see what you already know, so we don't waste your time going over things that you already know, and that I, as an instructor, can do my best job and teach you the things that you still have to learn. And so that's usually how I position it, and then also mention that it will show them, if they take it as a pre-assessment, and once they do some of the instruction, we'll show them how much they've learned, so that their time is being well spent. But I think that's a really wonderful question, and something that should be paid attention to when you're talking to people about if you choose to use these assessments. And if you get a lot of, sometimes people push back, say they want to learn the skill before they take the assessment. And, that's always an option too. If they want to just learn the skill and then afterward take the assessment, that's maybe not ideal, but that might be what's ideal for that person. Thank you for bringing that up. So once someone has taken the assessment, regardless of what assessment it is, they'll always get this results page. And you can see it gives you a score. North Star says you have to have 85% or higher to pass the assessment. But what I want to point out here is on the left-hand side in the green column, these are those standards that this person has passed. And on the right-hand side in the gray, these are the standards that they have yet to learn. So this really helps the person learning see what it is they still might want to work on. And if they are feeling like they want to learn something right after they take the assessment, they can go to where that barbell is on the right of the 5, where it says practice, click on that. And if they have the subscription model, could go right to the self-directed online learning. So they pass the assessment. They don't need to go through the entire practice lessons. This would just direct them specifically to those areas that they didn't pass. And so I have seen many people pass, but want to get 100%. So they're very excited to kind of just practice those specific skills. So the assessment, again, all the assessments are free. I'll show you where to find those. The free version, you would get this results page too. North Star just doesn't track it if it's in the free version. So you'd have to, write down the score or do a screenshot or something like that. And then in the subscription version, you would, as an organization, have those records available to you. Now, when an assessment is given, it can be, and this is on a case-by-case basis, it can be given either proctored or not proctored. And proctored simply means that you have someone on staff or a volunteer who's watching the person take the test to make sure they're not, getting help from somebody else or using notes. And this may or may not be important to you. If an assessment is proctored, then someone passes, then they can get a certificate. And so you can see that this man is holding he's passed all of the North Star assessments, and he's holding several of the certificates in his hand there. What the certificates we found really provide to people is they give people a lot of confidence. So oftentimes people who have lower digital skills are very afraid of computers. They're afraid of breaking them. They're afraid of wiping out all the information. They're afraid of doing something wrong. And having this piece of paper that is objective, that says they know what they're doing, can be very powerful. So I've had learners who will, give me high fives when they earn a certificate. They'll start crying. One man recently contacted his instructor and asked if he could print out all his certificates, so that the man had moved into a new apartment and he wanted to buy frames and hang them all up to decorate his apartment. So they are very meaningful often to people, and they often help them persist in learning these skills and potentially in other educational endeavors they might be involved in. So that's kind of the beauty of the certificates, I guess. I'm going to now move from talking about the assessments to the instructor-led curricula. The instructor-led curricula is only available in the subscription version. But as if you're thinking about even using the standards in the free version and the assessments, you can always use that, to create your own curricula. We've just done this for you in case you want to not spend the time doing that. So again, I've highlighted those in red, which might be of interest. Oh, I forgot information literacy. North Star's plan is to have instructor-led curricula for every assessment that we offer. We currently have 13 of the 15 completed. The team is now working on your digital footprint and just started on the telehealth curricula. So that assessment was just completed at the end of April, and now they've started the instructor-led curricula, and that will be done. By September. So the instructor-led curricula is aligned, as is everything in North Star, with those standards. It's meant to be easy to use. You don't need to have an educator degree. We at our organization often have volunteers use it who don't have experience in education. And it's very learner-centered. So it was created for adults. It was, and by that I mean, there's no content in there that maybe is not kid friendly, but it's more of what adults we think might be interested in. And it's very interactive because at North Star, we feel that it's very difficult to learn digital skills through lecture. You actually have to get in there and like practice them. So there's a lot of repetition in there. And I've heard from learners that they really like this. In fact, one learner, her quote was, "We don't learn a lot of things in any one class, but what we learn sticks like cement." So she was very appreciative of that because she felt very comfortable then after that repetition. The lessons too are nice because they're independent. So you don't have to do an entire unit if doesn't meet the goals of your student or of your organization. So you can pick and choose. So let's say you are just worried about the information literacy piece and you want to tie that with some basic internet searching. You could pull out the different pieces that make sense to whoever you're working with. So like I said, this was initially, maybe I didn't say this, but this was initially created for kind of classroom learning, but it's very easy to use for one-on-one. So if you're working with someone one-on-one, and again, you don't have to do the entire unit topic. After someone takes that assessment, you can see what they might need to know and pull out the various components there. If you were to do the whole unit, most have about 8 lessons in them. And then each lesson plan is, the curriculum developers thought it would take about 2 hours. So if you did the entire thing, everything in the entire unit, it would be about 16 hours. You can also use this very easily for remote teaching. I often do it when I'm working with organizations, and it's actually really enjoyable, I find, to teach remotely as well. So this is what the first page of the curriculum looks like. You can see it lists the standards that are going to be taught in this lesson. North Star has a scope and sequence, which is a document that shows all the standards in the unit topic, like the telehealth topic, for example, and then it would tell you what lessons each standard are in. So again, if you want to just teach specific things, it will easily direct you to which lesson you should be looking at. The lessons also include the digital literacy vocabulary that's going to be gone over, this technology concepts. This is telling the instructor kind of in instructor language what the objectives of the lesson are and any teaching tips they need to know. And then this prep guide really is just telling you what handouts to either copy, or you can, if you're doing it remotely, click on those blue links and it'll take you right to those handouts. So as we look a little further into the curriculum, what I really like about this curriculum is that it gives you the actual words to say and the tasks to do. So this can be really helpful. One, it means that it requires not very much prep time. I would say when I've taught it, and I don't normally teach a class, but when I did get the opportunity to do so, it maybe took me 15, 20 minutes to prep, and that was mostly making copies because it's so well laid out. And by giving you the words to say, it maintains consistency, across your organization. It also helps. Many of us know how to do things on computers, but we may not know what things are called. So it gives you the digital literacy vocabulary and maintains consistency in what you call things. And also, you may have encountered that, so for those of us who are digitally literate, it's hard to remember when we didn't know how to turn on a computer or when we didn't know how to search on the internet or use a mouse. And so sometimes when we're talking to people who are at that stage in their learning, we forget what that's like. And so we may describe things in ways that don't make sense to someone who does not yet have those skills. So for example, if I said to someone who didn't know how to search on the internet, if I told them to click on a link, that wouldn't mean anything to them. Those terms don't mean anything, but it's something that I do every day, right? So the North Star curriculum gives us the words to say in hopefully the best way that someone who does not yet have these skills can understand them. And so it helps us meet the learner where they're at. And so I also want to show, I'll answer the question in the chat in just a second. But the last thing I want to show you here is just, here's one of the handouts. And what I want to mostly point out is you can see the first names and the questions are from a variety of cultures. So in all that North Star does in the videos and the pictures and the names, we incorporate people of a variety of cultures in the hopes that those who are using North Star might see themselves in North Star or relate to North Star. So there was a question in the chat about any feedback about the proctor being present. Do people find this intimidating? I have not heard that. Most of the time people understand that, and they look, actually what I have heard more is sort of the opposite, in that people will look to the proctor as a person who can help them. So they'll often say, you know, I don't know how to answer this question. Can you help me innocently? Or do you think I should choose this answer? So more what I hear is from the proctors are that they are because they're all people who are, you know, doing this because they want to help people, that it's harder for them to not give any answers and to stay kind of neutral is mostly what I hear. But that's a really good question. All right, I'm going to now move to talking about these self-directed online learning practice lessons or online learning modules. And a few of these are available for free on our website. And then, so that would be the basic computer, the using email, Windows and Word and career search skills, I believe. Maybe not Windows, Word and career search skills are available for free. They're the same as what I'm going to show you. They're both the same on the subscription and the free version. The only difference is on the subscription version, you can stop midway. So each module takes about 90 minutes to go through. And on the free version, if you start it, you can't stop halfway through. You would have to finish it. I mean, you can, but you'd lose your progress. And so in the subscription version, you can do 10 minutes, then come back to it in another day and do 15 more minutes. And all that is tracked in the reporting. And again, I've just highlighted the ones that I thought might be useful to those working in with patients around digital skills. But in the subscription, all are available. So we currently have, let's see, 7 of the 15 completed, and the plan is to complete all 15. And I should say that if you are a North Star subscriber, as you know, for that annual fee, as we develop new things, they're added automatically to your subscription. You don't have to opt in. You don't have to pay any more. We notify you when we provide any information that you might need about them. And we have just hired we're a very small team. We only have 5 people. Now we have 6. Just hired someone to help us kind of speed up creating these self-directed online learning modules. So the hope is they'll all be done by early 2023. So let me show you what they look like, because it's easier for you to understand when you see this. So I'm going to click here. You should see a picture of a laptop, and you should hear a woman reading the words that are on the screen. If you don't hear her reading them, the words are there. And so I just won't talk until she's done reading. So let's take a look at this.
If you look closely at the outside of a computer, you will see buttons and many small holes. These holes are usually called ports. Each port has a specific shape for different uses and different types of plugs.
So if you can hear that, she reads very slowly and clearly. That's the same type of reading that is on the assessments. And so North Star, the self-directed online learning, has this instructional component, but then it also has a a practice component, because as I mentioned, we at North Star feel that you really have to practice the skills in order to learn them. So I'm going to click on the next button here and show you an example of what that looks like.
Here is a flash drive that you can plug into a computer. Click on the port that matches it.
So then if I click here, I'm told, yes, that is a USB port. If I had clicked on the headphone jack, I would be told, no, this is the headphone jack. Look for something that matches the shape of the flash drive. So the way the self-directed online learning works is you'll have this instructional piece, this practice piece, instructional piece, practice piece for several of the standards or those skills. And then there'll be a little quiz. And the quiz will say, you're ready to go on in the module or go back and review the material. And there'll be about 3 or 4 of those kind of sections. And at the end, there'll be another little quiz, about 3 questions that says, you're ready to take the assessment or go back and review X, Y, and Z. So it's very tailored to each individual and what they need to learn. So I will, did see something in the chat about where to access the free learning modules. I will show you that in a second. And someone asked that their launch said they're launching a campaign to encourage people of color to take more advantage of telehealth. Would it be okay to refer them to your website learning modules? Yes, you definitely can. People who are individuals can use it for free too. And they also can, if they want to go to a place that will offer them free lessons, they can put their zip code in and it will show them around them what libraries or agencies are offering North Star all for free. I will just say that there is no specific, there's a telehealth assessment, but no specific telehealth module like we're seeing right now yet. So that's still under development, or we're still looking for funding to develop it, I should say. But yes, and I will show you all those things in a second. So just wanted to point out that in the subscription version, we won't really go into this today, but unless you want to see it, but the learners themselves have a dashboard so they can track their progress. So they can see how they've done on assessments. They can see what they've done in the self-directed online learning. They can choose whatever they want to do in the self-directed online learning. So they have a lot of leeway there. And then those organizations who have purchased North Star, their staff can also see what the individuals are doing. So they can see individuals' progress, they can see the scores, as well as kind of overall reporting at their organization. North Star also will track how much time someone is spending on this self-directed online learning module. For some organizations, that's important to funding. For other organizations, that's just helpful information to know how many people are using it and how much time they're spending on it. So we do provide that in the report. A few questions. Do we have North Star in other languages? We are, I mentioned at the beginning that Literacy Minnesota, who created this, is an organization that helps people learn English. And so initially North Star was all in English, but now that many more other types of organizations other than adult education are using North Star, we have secured the funding to start translating it into other languages. And we have actually just started with Spanish. So we hope to have part of it in Spanish out this summer, and then we'll kind of roll that all out. And once we complete the first language, Spanish, it's much easier to add in, much easier and cheaper to add in additional languages. So the answer is at the moment, no, hopefully soon. And definitely we see that as a very important need. There's also a question about, do we offer subscription plans less than a year? We don't. It's an annual subscription, and it is normally a business-to-business setup, so organization to our organization, but we do have some people who let's say their job is they're helping people with digital literacy and they're consultants who want to buy it, the subscription price would still be that $500 a year though. But again, you can use the free version as well. So let us take a look. I just want to show you some kind of bigger picture reports that you can see if you have the subscription version, and then we'll look at specifically the free version and where you can find all that information and test it out. So let me get there. So I'm going to go into this summary report. So this is one of the reports, the kind of a macro report you can see that shows you how many assessments have been given at a particular organization. And if I hover over the pieces of the pie, it tells me, you know, at this organization, over 2,000 computer skills, basic computer skills assessments have been given. Now, this is helpful to prove to your funders how you're using it, but it can also be helpful. Let's say you are offering all the assessments and you're finding that a lot of people are really interested in internet basics. So maybe you decide then this is something that we should potentially have a class on or partner with an organization who does provide this instruction, because a lot of the people that we serve really want to know that. If I scroll down, I see this bar graph, and this shows me what percentage of assessments by topic have been passed. So again, I can, let's say I am working with a group of learners or patients, and I see that for them, you know, email seems a little easier. 68% of the people are passing the email assessment, whereas maybe the internet basics, a little bit less people are passing that. So maybe if someone doesn't pass email, I send them to that self-directed online learning. And if someone doesn't pass something that's a little more difficult for the group as a whole, maybe I decide to provide classes on that, or again, partner with an organization that might do that. If we look at the detailed reports, it gives you that same information, but if we go into view report, it will tell you how long on average it's taking your population to take this assessment. So if you do decide to do proctoring, it kind of helps with that time management piece. Then if you scroll down, it lets you know what questions people are having a really hard time with. So let's say you were looking at the telehealth assessment. This is not that, but and you could see like a lot of people are missing question 13. And if you scroll down further, you'll see that's highlighted by these brown triangles. Well, then you could go to question 13 and open it and see what that question was. So in this case, in this example, people are getting very confused about which mouse pointers do what. So maybe that's something that you make sure to work on your patients with, especially if it was around telehealth. If there's a few things that people kept getting confused about, maybe that's something that you want to provide some kind of instruction on, or pamphlets, or use it in that way. I would never say to you to teach to the assessment, but this just gives you some insight as to what might be difficult for the group that you're working with. So let us then just kind of again go over what's in the free and the subscription. And I did see something in the chat about do we offer lessons for different user levels, basic, intermediate, or advanced? I would say that in North Star, most of the assessments are and the curriculum are more they're beginner to maybe a little intermediate. So we don't have advanced skills like advanced pivot tables, for example. More around the kind of the basics of using digital literacy. That would be our niche. All right, so just again, what you can find and I'll show you what you can find in the free version are you can take all the assessments. There's no record of the achievement unless someone takes a screenshot or you write it down. Whereas in the subscription, you can get those records, you have reporting, and then you can do the proctoring for the certificates. In the curricula, in the free version, we don't provide any of our instructor-led curricula. That's only in the subscription model. However, we have provided links to external free web-based resources that we did not create, that other organizations created, but that we feel match the standards that we've developed. So we do provide that as another resource for you. For the self-directed online learning practice lessons, there are those 4 free modules, and you just can't save your progress as you go through it. And of course, there's no reporting. So let's look at the free version, and so you can see where to find all this stuff. So our website is www.digitalliteracyassessment.org. But if you put in North Star Assessment, you'd come to it too. So I'm going to go there. This is the home page. So I would encourage any of you who are interested to take an assessment yourself. I have yet to meet anyone who has passed all 15 assessments with 100% on the first time, even those in IT. So this just goes to show that digital literacy is lifelong learning. And many of us have taught ourselves digital skills, but we might have gaps because we didn't have to learn something, or we may not know the most efficient way of doing it. So there's always something to learn. So if you click on Take an Assessment, it will, oh, sorry, this is because I'm logged in. I want to show you what it actually looks like for you. I play dual roles here, so it gets confused sometimes. Okay, so if you click on Take an Assessment, you'll come down and scroll down a bit. You'll come down to all the assessments here. And if you would just click on one, you'll hear some cello music testing the audio. You'll have the opportunity to watch a short orientation video if you want to, and then you would take the assessment. If you are interested in seeing those self-directed online learning practice lessons, you can go to where it says Build Your Skills and go to See More. And then here is what number 1 was, where I was telling you, someone asked about could individuals use the assessments, and they can. And if they were interested in going to a place that actually had maybe classes, they could click on Find a North Star location. They or you could help them enter a zip code and press Submit. And then it will bring up a map that shows all the places around them that offer it. And if you click on a place, it will tell you what is offered, if they have classes or not, where it is and who to contact. So again, this is something you can provide to any individual that you work with to show them what's available in their area. Number 2 here, I was again under that Build Your Skills, that gold oval. Number 2, these are those 4 self-directed online learning practice lessons. So like the example I showed you, these are the 4 that we have. And you can, please feel free to go through them and see what they're like. And then number 3, those are those other resources I was mentioning that we have curated. And so what that looks like is we've again organized it the same way, in the same order as our assessments. If there's a book, it means it's a text resource, or it could be a video, or it could be something that you do. So if we look at information literacy, for example, this is our standard 1. It gives you what the standard is, and then here's a resource that we feel teaches the standard 1. Now it might teach more than just the standard, and these are all different, but they're all free resources that you can take advantage of. The telehealth links have not been added yet, just because we just released it. And the other thing I want to show you is where the standards are. So I'm going to move my Zoom controls here. So if you look, if you're back at the home page, if you look at the top in this black navigation bar under Features, if you click on Features, and then you look below this woman's face, it says North Star Standards. So here are all the standards, and again, you can click on them and it will tell you, these are the skills we feel that are necessary to be competent in this area. So if you just want to use a free version to kind of create your own curriculum, you can definitely feel free to use the standards. There was a question, can North Star be incorporated into an EMR like Epic? We are working on that. So it would probably require some integration from your IT team. But we are definitely open to discussing how that might look. And we're actually just had a conversation this morning about what resources it would take for us to make that easier from the North Star side to do. There was a question about helping people learn Zoom. And we actually don't have any assessments around Zoom. In the curriculum, we talk about how to have a Zoom meeting and kind of what things to talk about with people. And actually this is kind of diverging, but on the Literacy Minnesota web page, there are we've created some IKEA-like Zoom cards that were meant for learners with low literacy to use Zoom, and they're written in 5 different languages. It's English, Somali, Hmong, Karen, and Spanish. And so you can feel free there. I don't know if we're running out of time, I know, but if you look under Literacy Minnesota, under Educator Resources, you should be able to find them. I know that our session is at the end. And so I want to thank you all for attending. Feel free to, if you have further questions, feel free to contact me. And here's my, I put my email in the chat. And then I hope that you have a wonderful rest of your conference and day. So thank you all. Goodbye.